Good morning, everyone. My name is Ray Dick. I'm the president of the Massachusetts Health Officers Association. We want to welcome you this morning to our MHOA Local Public Health Resource Guide webinar. This morning, just a couple of housekeeping items. We will be sending out your CEUs this week. If you have any questions regarding those, please let us know. Q&A, so all your question and answers, if you want to use that function, we will be answering those questions as they come up. This morning, we would like to welcome Dawn Sibber, who is our current executive director here at MHOA from the end of it. She will be outgoing, and Teresa Kett will be our incoming executive director. So we want to welcome her. So this morning, Dawn's going to give us an introduction to the guide. Thank you for joining us.
Thank you, Ray, and good morning, everyone. I appreciate you joining us to learn a little bit about the Guide to Local Public Health in Massachusetts, something we introduced in 2021, and we have revised and reintroducing it now in December of 2022. So before we begin, we thought we would do just a quick poll to see how many of you are new to local public health, how many of you have been here for a while. So if you would just take a second and answer the poll, that would be great. We would love to see who you all are in terms of how long you've been in public health, local public health. So we'll just take a second. And I think we probably can end the poll so that we can see now that most of you here have been in local public health for about 1 to 3 years. So, and some of you for less than a year. So welcome to the new people, and thank you to all those who have been with us for a while. I think we're going to stop sharing the poll results, but that's really interesting. I hope this guide provides some information to you if you're new or if you've been with us in local public health for a while. So I'm going to start. We will go through the guide for a few minutes. I will review the different sections, how to access it, and then we're going to present the Local Public Health Institute, which is an incredible resource for local public health. And Olivia Stenger from LPHI is going to share with you how to access the Local Public Health Institute and some of their many courses, most of which offer CEUs. And then we're going to end with a panel of local public health officials who are going to share some of their experiences and ideas for using the guide. And again, please feel free to ask questions as we go along. So I'm going to hopefully. This is a thank you slide to folks who helped us with this guide. And this guide was originally developed with a grant from MHOA and from the Centers for Disease Control when we did this. And we had a lot of reviewers and folks who helped us put this together. So I just want to say thank you again to those folks. The purpose of this guide was for it to be a resource that would help local health be successful in your job. It's not an exhaustive list of resources, but it's a place for you to begin so that you can research what you need. And it's a live guide. We've just updated it, as I said, and we will continue to update it. And I ask of you, if you look at the guide and you know of resources that we are missing, please let us know so that we can add them. This is really something that we want to keep live and really helpful to all of you. Sorry. So this is how you access the guide. This is the link, but you also can access it through the MHOA site at mhoa.com. And it says resources, and you click on the guide and it will take you. And I'm going to show you what that looks like in a minute. You sign in with your name and email address. We're just keeping track of how many people and where their towns that they're from and who's looking at the guide, just for our own information. As I said, we are updating the guide regularly. It's self-paced approach. You may look at some chapters. Often you may not need some of the chapters. So there are resources to start your work. And again, we hope that if you have any resources that you know of that aren't on here, that you add them for us. And there is a glossary of common acronyms in this guide to help you as well. Oh, sorry. So I'm gonna now show you the guide if you haven't seen it already. And this is what the screen looks like when you start, except you will have to sign in. You will get the sign in, and I do not, because I've signed in so many times it recognizes me. So there is a menu on top, which would allow you to see all the chapters, and there are 20 of them. You can use this, or you can simply use, sorry, my screen is not cooperating. You can see the introduction here, and you can, sorry, scroll down and see all the chapters this way. For some reason, I don't know if you can see this, but there, now you can see one. So there are 20 different chapters. And I'm going to quickly go through them really quickly and show you how it works. So this is chapter 1, which is simply an introduction to the public health system in Massachusetts. And each chapter has an introduction, which tells you what is coming. And then we have topic areas and resources. And in every one of the chapters, every resource will have a live link. We've checked them. I'm not saying that it's perfect, but you could, hopefully most of them work. So I'm just going to click on one and hope that it works. We've gone through them. So Public Health 101. So that's what you do. And you can find the information for every topic area about reviewing the public health system in Massachusetts and the resource. And you simply go to next and you get the next chapter. And this is about public health law and statutes. And again, same format. There are often questions about the open meeting law, public records law, conflict of interest, all different kinds of things. So fiscal management and budgeting, same thing. And you can simply, all of these things you can click on. I find this really interesting. We have one of the topic areas is potential grantors. And these are some of the foundations across Massachusetts where you can find grants. So if you happen to be in Brookline, you can find information there. Again, all the links are there. And this is not an exhaustive list, but someone might know of other things that we could add to this, which would be great. Human resources, and this has a lot of information about personnel, consultants, contractors, and volunteer management. I was actually looking at this site last night because I thought the Mass Service Alliance site had some really great resources for managing volunteers. And I was looking at it actually. As I said, so they have a lot of really good information and forms. So that is, and there's information about our Academic Public Health Corps, which I'd like to highlight, which is a program that's funded by the Department of Public Health and MHOA has. And we have Tali Schiller, our program manager, has designed a great website. And if you need any help in your health departments, please check on request services and fill out the quick form to get some interns to assist you with your work. This is a fabulous program. It is free for local public health, and we could use some projects for our students to work on when they come aboard the new cohort in early January. Leadership skill development, all about different kinds of trainings. Organizational development. All about, again, developing an organization, strategic planning, vision, mission, values. Communicating. Some great things about social media use, mass communications, risk communications, some really some great links here. Health equity, some good information here. About health equity, environmental justice, and resources available. Data and informatics. NGOs, non-governmental public health partners, some folks, again, you can work with. The Coalition for Local Public Health are the 6 statewide public health organizations of which MHOA is a part. And you can click on any of our links to get information. Many of you probably know what we do, but if you don't, there's information there, as well as national organizations. NHO is MHOA's partner. We are an affiliate of NHO, and NHO is truly our local health department's biggest national advocate. They are fabulous. And again, in 2023, MHOA will offer to every local public health department in Massachusetts a free membership to NHO. You'll be getting that information soon. We hope that you belong to MHOA, but we will be offering it free again for the 2nd year to every local public health department because we think they are such an important resource. Public health nursing, and we have Gail Johnson from Westford, who's a public health nurse on our panel, and she'll talk a little bit about public health nursing, but there's information here about public health nursing and some of the many jobs that public health nurses do in our local public health departments. The biggest chapter is on environmental health, and I know Ray Dick from Westford also is going to talk a little bit about how she's used the guide with environmental health topics. This is a huge chapter with all kinds of environmental health topics and resources, and as well as examples of local regulations. So you can see, if you're interested in regulations, some of the regulations that there are locally. So this is, I'm not going to go through it all, but it's a pretty exhaustive list of environmental health topics. Emergency preparedness, again, topic areas and lots of resources. Population health, some really interesting and helpful resources as well. Substance use, prevention and intervention, more resources, and a link to our MHOA opioid toolkit for local public health, which was just completely revised this summer and has a program also associated with it. I'm not sure if Olivia is going to talk about it today, but there is a training module at the local public health institute as a companion to go along with our opioid toolkit. This is a great, I think there's a link on here as well to get to the BU site. So this is our opioid toolkit. If you haven't checked it out, it's got some great resources in it. Every chapter has resources. So please look at it, and the companion module on the local public health institute is also really fabulous, with some videos done with some of our local public health folks as well. Mental health, a huge area of interest. Again, lots of topic area. Other public health functions, there are some things that some health departments deal with and others do not. So we've added some extra topic areas as well. Emerging and evolving public health issues. So there are some issues that we think are really important that are on here as well. And the last two chapters are the common acronyms and abbreviations. So not exhaustive, but hopefully helpful. And as well, those that have links, there are links so that you can go to them and see more about what the acronyms stand for. And lastly, these are our MHOA officers and representatives, and they are folks you can go to ask about resources in your area, or just generally. Their email addresses are on here. It will change in 2023 because we have new officers coming in, and we will update this. But MHOA officers are really willing, and board members are really willing to help assist others in local public health, and some of them are with us today. So that is the guide in 10 minutes. Please, I hope that you'll spend more time on it and really look at it. So now I'm going to turn it over to Olivia Stenger from BU and let her talk a little bit about resources that LPHI offers. So I will stop sharing so that she can share. Thanks, Olivia.
Yeah, thank you. Just gonna get set up here. So thank you, Dawn. Good morning, everyone. I'm Olivia. I'm the program assistant for the Local Public Health Institute of Massachusetts. And we are housed in the Department of Community Health Sciences at the Boston University School of Public Health. So the Local Public Health Institute is a comprehensive, convenient resource for public health trainings that help build and maintain a skilled local public health workforce. So types of training that we offer, we have a catalog of over 60 free self-paced trainings. And what you see is our homepage. And so if you go to our homepage and you hover over the training, you'll get a drop-down menu. And if you click on your time, that will take you to our table of self-paced trainings. They're all free and they're all online. And it's a pretty comprehensive list. And our trainings are focused on 4 areas: environmental health, population and community health, emergency preparedness, and leadership and communications. So we have some new trainings that we've released this year: designing effective infographics for public health, surface water sampling, and cyanobacteria and harmful algal blooms. And so those are all live and available on our website. And you can find those in the On Your Time trainings that I previously mentioned. We also have updated two of our trainings: orientation to local public health in Massachusetts, and health promotion and health equity. These trainings have just been updated this year, and they are also live and available now on our website. So we do offer CEUs. So this is the table of all of our On Your Time trainings that I had previously mentioned. So if you go on our website, go to training, On Your Time trainings, this is what you'll see. It's a table of all of our self-paced trainings. And I have circled in red the number of contact hours that you'll receive for each training. And then to the left, you can see who the hours are for. So once you enroll in the course and complete the course, you'll automatically receive the CEUs. And this information is also available on the individual course page. So if you were to click on any one of these courses, you would be taken to the course page, and the information about CEUs would also be available there. So once you complete the course, you'll automatically get the CEUs. So other resources that we have a news and events section where you can learn more about new and updated trainings. That's on our website. So this is on our homepage, a little bit towards the bottom. So if you scroll a little bit, you'll see the news and events section towards the bottom. And in addition to our news and events section, we also send out newsletters with our own updates. So if you would like to sign up for our newsletters, there is a link to our sign up sheet at the bottom of our homepage below news and events. So if you go to our homepage and scroll all the way to the bottom, there's an option to sign up for our newsletters. And I've also made this QR code in case anyone would like to scan it on their phones and just be taken to the sign up page directly. So we send out, usually we send out a spring newsletter and a fall newsletter. And then occasionally we'll send out 1 or 2 more. So it's not more than 4 a year. So it's not going to be many emails from us. Usually just a couple a year, just to give some updates about new trainings, updated trainings, new additions on our website. So if you're interested in signing up, it's a great way to stay in the loop about what we've been doing. I'll give people a second if anyone wants to scan that. So other resources we also offer extended trainings. So our Foundations for Local Public Health Practice is a really great place to start if you're new to local public health. And I know that there's some new people here that are new to the practice. So this course is a really good place to start. It's a comprehensive course. We also have a page on our website that's dedicated to folks who are new to local public health. And I will show you where to find that on the next slide. And you can also learn about other partners and other organizations on this page. And we also have our Introduction to Local Public Health for Administrative Staff course, which is a new training that we very recently launched. And it's for administrative staff for local boards of public health. And then we have our mini MPH and our Mass Fit housing training, which we are currently in the process of updating. So this is a screenshot of our homepage, and at the top you can see the new to local public health section that I had mentioned. It's right at the top next to training, about, and partners. So if you click on that new to local public health, it'll take you to our page that is dedicated to folks who are new, and it's basically a really great list of resources for people who are getting acclimated and still learning about local public health. So if you're new, I would highly recommend checking that page out because we have a lot of great resources there. And we also have this red arrow is pointing to our training calendar, which lists local and federal events. And we try to update it every month with whatever information is available to us. So it's a really great way to stay in the loop about local and federal events that are available and that are happening. And this is right on our homepage, so pretty easy to access. And if you have an event that you would like us to list and put on our calendar, you can send an email to Winnie, who is our program manager, and I have her email here. So this is her email address, ojaswini@bu.edu. If you want to email her about an event you want listed, we'd be happy to put it on our calendar. And also, please follow us on LinkedIn. If you have LinkedIn, we are trying to be more active on there and grow our audience, and we would love to see you on LinkedIn. And this is our website, sites.bu.edu/Mass Local Institute. Yeah, that's all I have.
Thank you very much, Olivia.
Of course, thank you.
I think there was a question. Let me just see, just someone who was thanking you. Great to see that his alma mater is staying at the forefront of public health. So one of the questions is the new module for administrative staff directed to managers, directors, or administrative assistants?
I think it's more for administrative assistants, but I'm sure it could be beneficial to everyone. I think it's more dedicated towards people who may not be super familiar with all of public health, but who are working at local boards of health in administrative positions.
Okay.
But yeah, I'm sure it could be helpful to a range of people.
Okay, okay, thank you. People are very excited about that. Got some nice job and wonderful comments. So, one of the things that I could do is maybe just take a second and show what the live site looks like if you want, because I realized I have a link to it. So, I can share my screen and we could just do that for a second if people wanted to see that. Sorry, I just need to. So this is what it looks like when you come to the live screen. So it's so easy to access, and it is such a wealth of information for folks, and all of the 6 statewide public health organizations that I mentioned earlier are all on here. And it's such a great resource for local public health. And if you haven't been on it, I really suggest you look at the site. So it's wonderful. So thank you. I don't see any other questions for you, but if at the end during the panel, if there are any questions, Olivia, you'll still be on, correct? So,
Yes, I'll still be here
Okay.
if anyone has any other questions. Thank you.
Okay. Thank you. Thank you so much for sharing this. So, as I said before, we have MHOA regional at-large reps, officers, other board members who are willing to help. So please contact anybody for assistance. And with your public health excellence grants and training hubs and all kinds of other resources, there are folks who will be glad to share their experience and information with you. So I'd like to introduce some folks who are on the webinar today, who are going to just share some of their experiences. So Joanne Belanger is the health director for the Lexington Health Department. Jane Smith is the director for Alfred and Sandusfield Health Departments. Melissa Ranieri is the director in the Walpole Health Department. Ray Dick is the director in the Westford Health Department. And Gail Johnson is the public health nurse in the Westford Health Department. So I'm going to stop sharing my screen and let them join us and talk to you all a little bit about some of their experiences. So they're going to introduce themselves to you and let you know about some of their experiences and ways in which they could have used the guide or could use the guide, and helpful hints. And also, please use them as a resource here this morning and ask them any questions that you may think of as they speak. So I'm not sure who's going to begin, but Joanne is in the top of my screen, so.
Okay, Dawn, I'll go first. So hi, good morning, everyone. I'm Joanne Belanger. I'm the director in Lexington. So if anybody's in this area, please reach out, or wherever. So I've been doing this a long time. I just did some math while we were waiting, and it's been 35 years last month that I've been in local public health. Most of my career was in Andover, and now I'm here in Lexington, and I've been on both sides of the desk, if you will, or the counter. So I started in environmental and then moved into the clinical side. I am a public health nurse. So I was the assistant director in Andover, which is a clinical position. So I've kind of done it all. But I have to say that, you know, going back in time, it was a learn on the job kind of situation. And I had academics, but there wasn't any training manuals. There wasn't any books to reference. It was, you know, all an interest in public health and in epidemiology and in community health. And then learning as you went. We learned from each other. We learned from the engineers out in the field. We learned from, you know, my predecessors brought me through all the different issues in the environmental side, you had to read the regulations and interpret them as you saw them. So I am encouraging everybody, especially anybody that's new, to take a look at this guide. It is phenomenal. Everything that you could ever want is in there somewhere. I wish it was there when we started, but I'm looking at some of the reviewers, and some of them are the old schools like me, who kind of did it, but pulled up our bootstraps and did it. And we want to move the profession forward and make sure that everybody has the same trainings, that everybody is learning the same thing, and that this guide is going to be a real change in how we view public health in Massachusetts. So, you know, again, I've kind of done it all, seen it all, but I still use this guide. I still reference it. You never know everything. One thing I can tell the new folks is every day is a learning experience. If we didn't get that 3 years ago when COVID popped up on our doors, that we don't know anything and we don't know everything. But this is a reference guide that we can use, and all the material and the trainings are there, including, again, resources from people who have seen and done it before. So I'm going to turn it over. If anybody has any questions, obviously I think the way this is going to go is pretty kind of laid back, and you know, feel free to ask questions. So I don't know, Dawn, do I get to pick somebody in the magic squares, or
Sure.
are you going to do it?
No, you can do it.
Okay, so I'm going to go to Jane.
Oh, thank you, Joanne. It's great to be here. My name is Jane Smith, and I'm the health agent for a couple different little tiny towns. So Alford and Sandusfield. Don't worry if you've never heard of them. Most people haven't. And I'm also the shared services coordinator for one of the public health excellence grants. So I've worked a lot in Berkshire County, which has a lot of small towns. I mean, I think in our public health excellent grant, our smallest town, I think, is 160 people. And then it goes all the way up to nearly 8,000. So what ends up happening in these is that, you know, each individual local board of health is responsible for providing their own public health services. And so naturally, you'd see a lot of health inequities between the towns. So over the years, which I also did a little math, Joanne, and I've been here in public health for about 10 years at this point, and look forward to many more years. But I think that, you know, this type of a resource was really needed. And when I started in 2012, when I started back up in public health, I remember every day was a different adventure. You know, one day you found out that you were in charge of issuing death warrants for beavers, and then the next day you found out that you were also responsible for clearing houses before they were demolished, and there just wasn't good resources for that. And if you go into the files, the alphabetical files, and you know, the information would end up being 10 years old or more. So there was no assurance that you were getting the most up-to-date information. When I left my first position, it was in Great Barrington, I actually made little folders. So similar to what you have on the environmental health side, physical folders, and that really only helps the people who have access to those folders, right? We've tried to do it online, same type of a thing, or in our like individual computers. But again, it's just depends on who has access to the computers. So this is revolutionary because it is staying up to date, and it's also sanctioned by the state, right? So you can have confidence that the information lying within is a good guide and a good resource for you. And I think it's good for training a lot of the new workforce, but then also for us old fogies who have been in it for a little while. We're learning all the time and being challenged, I think, at least in the western part of the state, for the first time to really think of beyond the nuts and bolts of public health, right? That environmental health section has been, you know, all I have talked to up to this point. And yet there are so many other things that we need to do. And I feel like this guide is also good for boards of health to understand their scope and responsibility, especially as it pertains to health equity. And so I look forward to being on this panel, and thank you so much. Gail.
Hi, thanks. Thanks for having me here today. I wear kind of two hats. One as the public health nurse at the Westford Health Department, and also the president of the Massachusetts Association of Public Health Nurses. And I use the guide for students when they come in. It's great to kind of show around all the 20 different chapters that are in the guide. Our students sit awestruck in my office with all of the things that a public health nurse does, but also what the agents and health directors and everyone does in this department, food inspectors, health and wellness coordinators. And it is just a litany of information, and it's wonderful. And kudos to all that really put their minds together to put this together. We at MAPHN also have the orientation guide for new public health nurses. And we work collaboratively with Local Public Health Institute, which is also an amazing resource, and working with them to help us try to come up with our own webinars for the new and actually the seasoned nurses. There are so many there's so much more information out there. And as Joanne alluded to, the COVID pandemic really was quite eye-opening and threw us all for a loop. So it's really wonderful resource to have all the CDC information, all the Department of Public Health information, really at every link. You just go on out of those 20 chapters and just move all around and just press all these links. It's so amazing. So it's great to work in collaboration with MHOA and LPHI and all the acronyms that I'm hoping you'll show again or get on the guide. There's just so many, but really being a nurse and just learning all of the new things. I've been a nurse for coming up to 31 years, 22 years at the bedside, and coming up to 9 years as a public health nurse. So really I'm a newbie. So I'm still learning. Public health is just ever changing and always a great reference because we're going to need it. Everything's changing so rapidly. So that's all I have for now. Thanks. Oh, sorry. Ray, you're next.
Well, thank you. Good morning. So for me, I've been in public health for 16 years. I was in college, and I actually met a health agent who came in to speak to us about public health. I had no idea what's a septic tank, what's this, I had no idea. What does public health do? And I instantly fell in love. I was so excited to hear the stories about inspections. It sounded like a New York bestseller. I was so intrigued, and I actually stumbled on MHOA and started my internship there and fell into this position here in Westford, and I've been here ever since. It's always interesting to meet people and find out their start, and I don't know about you, but a handful of inspections and here you go, you're thrown to the wolves, like so many of us. And so I remember thinking to myself, oh my goodness, like the state of Massachusetts is letting me go inspect a restaurant. I have no idea what I'm doing. And so it was quite interesting. I would say, being on MHOA, one of my biggest frustrations over the years is not a standardized training for everything. And I know we've been working really hard to start housing training for inspectors. And this guide is really a great tool if you're just starting out. It's a great tool if you've been doing this for 100 years. Whether you're an inspector, or we're all inspectors, right? Whether you're a director, you're an agent, you're a food inspector, a nurse, we're all inspectors. So we're all out trying to save lives. And so I would just want to share that some things that have really helped me in the field, you know, for instance, if you haven't done a pool inspection for a long time, you might need a refresher. The local Public Health Institute has a 2-hour training and they show you step by step to actually go take samples and do the inspection. It's absolutely great. If you're brand new, it's a great way to start and build that foundation. With the public health guide through MHOA, things like environmental health, maybe you've never come across a beaver inspection. You know, you're out there looking at a big pile of water, you have no idea. This is a great way to go and just find that, you know, immediate information, the public health threat. The beaver guide is terrific. When I started out, I started going to all these meetings for emergency preparedness coalitions, and they're talking about these acronyms that are just like, God, what's LSAC, what's CLPH, what's this, what's that. So this is a great way you can go and look up those terms and acronyms and find out what they mean, and they can be really helpful in the field. And as you're growing, if you're looking to grow in the field, then maybe go push yourself up to a new position. You're aspirating to be a director, or you'd like to write grants. There's great information here where to find grants, to build leadership, to find those courses. You know, your questions about public health law, a lot has changed with COVID, as Donna said earlier, with open meeting law. This is really a great place to get all that information that you might be looking for. So it's a great start. So if you have any questions at all, we're all here to help. And just remember that I always tell all our interns that, you know, we all started somewhere, and so no one's above anyone else. So, you know, don't be afraid to ask questions, and we're here to help you. Thank you.
I think I'm the last one. My name is Melissa Ranieri and I'm the health director for the town of Walpole. So I started in this department about 9 years ago. So I went to school actually for food and nutrition and started in the department just doing food inspections, part-time, about 19 hours a week. My predecessor was actually going to be retiring in about 6 months. So kind of right place at the right time. I took all on the training for septic inspector, soil evaluator. I got my RS. And I fell in love with it. It wasn't something that I started off thinking that that's where I would end up, but the path led me that way. And then 5 years after that, the health director, long-term health director, was retiring. So I was promoted to health director. But I kind of echo how everyone else is saying, like, it's never a dull moment. You never are going to know everything. And it's funny that both Joanne and Ray brought up the beaver, because that's what I was going to touch upon. The beaver permit, how is that health department? But having the local public health guide is so helpful. Topics that you think aren't in your jurisdiction they always are. For somehow the umbrella of public health is always so large. But I would say my best recommendation to anyone out there, don't be shy, reach out. There's 350 other cities and towns who maybe if you haven't gone through something, they have. So don't recreate the wheel, reach out. If you're new to the field, shadowing individuals is super helpful. We're always open to having, individuals tag along. If we have a food inspection, pool, camp, call a neighboring community. I think studying for the RS exam, I remember being so overwhelmed, and it was told to me, like, you're not an expert at everything in public health. You're a generalist. You know a little bit of everything, and you know where to find your resources. And I think that's the biggest issue. So don't get overwhelmed. You have great colleagues among you, and definitely don't be shy to reach out. So I'm happy to be on the call today and answer any questions anyone has.
Thank you, everyone. There are a couple of questions. One is about how to join MHOA. So that's an easy one. And you can join from our website, mhoa.com. And there's a couple places where it says join and membership. So thanks for asking that question. And there's a question that says, I'm an LPN. I have experience in public health, emergency management, but need to find a mentor. Where do you recommend I should search? So maybe Gail, you want to take that, and others want to chime in. And I can also say that MHOA is beginning hopefully a mentorship program in the fall. It will be small to start, but we're developing a guide for a mentorship program this spring with a small grant we've gotten. So it will be something that Teresa Kett, who is on the Zoom, will be assuming assistance with. So if you haven't met Teresa, she is the incoming executive director for MHOA, as I will be, as Ray said, outgoing at the end of this month as I retire. And Teresa will be leading that mentorship. So there will be that. But for now, I don't know, Gail, if there's a public health nursing mentorship or other kinds of mentorship that some of you do formally, informally.
So we are working actually on a mentorship. We have been talking about the retirees, all the public health nurses that have retired. There's so many that are so willing to just reach out to. They're wanting people to just kind of pick their brains about, public health nursing. But really, there are 351 cities and towns, as Melissa just alluded. There's so many. You just call a public health nurse in any town and really just call them, email them, and reach out to your local health departments and see if they're available to really be a mentor. So that's one way.
Any other feedback? I will also say that as part of the capacity assessment, which many of you, probably most of you on this Zoom are familiar with, to guide and work on this, to really put it together, MHOA has been working with 19 subject matter experts, and most of whom are retired from local public health and public health nursing. And they all have been so willing to help. There are a few that are still working actively, but they are also great resources. And with our mentorship program, we hope to get some of them to join us, but know that there are a lot of people who do want to help.
Get on the maphn.org, and there's just so many nurses and executive board and the board of directors that are at the ready. We're very, easy to reach.
Any other comments from any of the panelists about mentorship?
I just think of, I just want to kind of echo what Gail said. Over the years, we've had, a number of schools that have reached out, whether it be a school of nursing or a school of public health, that need to place, say, like a senior into a program. I think the academic public health core is like a fantastic thing that came out of COVID. And that's another way too, to find some resources in terms of getting, some mentorship out of it, or getting, some more resources. But I noticed there was a emergency preparedness piece to it too. So I wasn't quite sure if it was more of a nursing preparedness or general preparedness. So I would say, just reach out to whoever's around you locally, or anybody, that look through the MHOA, membership list, because again, we've said it, 351 cities and towns are little groups of individuals. And so there's plenty of people out there that would mentor, even, even if it was just from a AP side, or if it was from a nursing side or a put together side.
So there are a few questions. One is, can we download the guide, or is it only available online? It's available online, and I think that you can download the whole thing. I'll get back. I know the person that asked the questions, so I will get back to you and let you know how you can download it. I just have to check with our IT person. I think there's a way. Because I'm not pulling it up again. I think there's a way in the top right-hand side, but I will get back to you. Where, Gail, is the new orientation guide? Is it on the MAPHN website?
Yes.
Okay.
I was just answering in the chat. Yes. So the maphn.org is where the orientation guide lives.
Right.
So that's where you can get that. Yep.
And then there's a question. What are your recommendations on getting through the RS exam approval process? I began the process in October and have not had any luck getting information on what the status of the review of my application is. Anyone have any answers to that? Those of you with RSs?
Well, I was just going to mention the fact that, you know, everything is being changed over from the Board of Registration into the Department of Public Health, which may be part of the problem. So a little patience maybe as that transitions over the first of the year. You could probably reach out to the Office of Local and oh, I have to move around in my office. My lights just went out. Reach out to the Office of Local and Regional Health and kind of see where it is with the RS. That's the only thing I can think of in terms of the process.
Someone suggested that they go to MHOA to review your application status. So if it went through.
If it went through that, if it was a MHOA one or a Massachusetts one.
Yes, the question is it a Massachusetts RS or is it a national REHS?
Right.
But I would, yeah, I think reaching out to the Office of Local and Regional Health is probably a great idea. So any tips for someone who's interviewing for a public health nursing position?
Right, that's gonna have to be taken offline. I would love for anyone who would like to reach out to me.
Okay.
Because that's a lot. A job description for PHNs will take a lot more than what we have right now. I will type my email into the chat so that if anyone does have any further questions, I'd be happy to answer.
That's great. Thank you.
I'm gonna chime in on that. Everybody's looking for a public health nurse. So there's lots of jobs out there, and being flexible and open to learning. Gail can walk you through, you know, some more specifics, but I don't know, there might be people on here that are going to be targeting you because everybody is looking for public health nurses right now. So it's a good time to be a public health nurse.
Yes, it is.
Somebody said, Gail, they see the core competencies for public health professionals, but they don't see the public health nursing practice guide on the site. They must have gone to the site. So if you have the link, maybe you can type that in, the exact link to that.
So I'd have to go around. I don't have it at my ready.
Okay, all right, that's fine. We
don't
can,
have it.
Yeah,
But I will, though, however, be able to, but then I will,
if the person can contact you directly.
yeah.
So,
see if I can put that on.
and then someone's pointed out that the public health excellence training hubs, which are not yet up and running, but hopefully will be soon, will be doing consistent, sustained mentoring to public health excellence inspectors. So once the training hubs are up and running, hopefully, I don't know, summer, maybe, spring, summer, then there will be a lot of training and mentorship at that level. So thanks for pointing that out. I don't see any other questions. I don't know if anybody has any questions who hasn't asked. So please put your questions in the question and answer section if you have not already answered. I don't know if any of you have any closing comments. If nobody has anything to add, we can end. CEUs will be sent to folks. And somebody asked earlier about CPFS CEUs, and yes, those will be sent as well.
I have a question, Dawn, real quick.
Yeah.
I'm not, if people, as people go through and use this, if they have suggestions or additions, like having the practical guide, where can they send the suggestion so that this continues to be a live document that's meeting the needs of our public health for?
That's a really good question. I think that we will add that to the guide. It's not currently on there, but I think that's something we will absolutely add to the guide because we want that. I mean, rather than, I think we needed MHOA to decide which address is the best. So we will add that. And we will add that within the next day or so. A couple quick quick questions right here. Someone asked if anybody has adopted a body art regulation recently. On the panel, I don't know if there's anybody on the panel that has.
Yeah, Don, we actually just did the town of Westford, and we just added a apprenticeship program to our
Okay.
regulation. If anyone's interested, they can reach
Okay.
out.
So perhaps that person can reach out to you. Maybe you could put your email address in the chat. And Gail, somebody actually asked for your email address in the chat. I'm not sure it went through. And one other question is, does anybody have any suggestions on getting soil evaluator certification? I can only find it through NUIPIC. Is there anywhere else to get the training?
So unfortunately, right now, it's only through NUIPIC, and they do have a backlog, and COVID didn't help that out. There was a backlog pre-COVID, and so they are working to bulk up the amount of classes they offer. So just try to hang tight.
Okay, yeah, and I think that's being worked on as well.
Do we want to talk about the
And
upcoming trainings?
Yeah, just Yawa, the Yankee On-Site Wastewater Association did a basic soils training recently. So perhaps in the chat, you could put your email address if you're offering more soil training, or you could reach out to Yawa. I'm not sure how this person wants to do it. I don't want to give her email address. Oh, okay. So I see that we can't. So Jen said she has shared Gail's email in the question and answer. But it's G Johnson, right, at westfordma.gov, correct? So, and if you have on our MHOA website, you can go to the roster of public health and it will give you email addresses of the directors. But you also can get it through the paper roster, but and Ray would be the one to contact our Dick at westfordma.gov about the body art regulation. And Joanne, you wanted me to talk about housing code?
Well, no, in relation to the soils, to talk about the
sorry.
DEP MHOA upcoming trainings in the spring.
Right, yes. So MHOA and DEP offer a training in the spring, and it will be, Jen, it will be in March, and there will be a live training this year, one live and in person, I should say. They're all live in person and also online. There'll be options. You can do a webinar or an in-person, and those details will be coming out very soon. And there will also be a Coalition for Local Public Health sponsored housing code training in 4 locations across Massachusetts with community sanitation to update everyone on the new housing code. That information will be coming out relatively soon. We hope they will begin at the end of January or beginning of February. So yes, it's hybrid, 1 in person, 2 part virtual, Jen says about the DEP. So lots happening. Please attend trainings, and thank you very much for participating. If we didn't get to your questions, we will try to. So people are asking for your body art information. And I don't know if you've seen that, Ray, in the chat before we finish. And someone also mentioned that the University of New Hampshire has some great soils courses on wetlands too. So if you need anything, please be in touch. So thank you very much, and happy and healthy 2023 to everybody. Thank you.